Plus, it's giving women hope across the country. The newest development in breast reconstruction. It's called Aeroform. And coming up next here on the morning show, we're joined by one patient who's already seeing results.
Look at you.
Yes, ma'am. Yeah. Welcome back, everybody. Women deserve a comfortable road to recovery and the highest quality of life following a mastectomy. Currently, women who elect for breast cancer reconstruction surgery can face a lengthy and painful process with today's conventional needle-based tissue expanders. Well, there's a new tissue expander called Aeroform, a patient-controlled breast tissue expander that could change the field of reconstructive surgery. And this morning, we have Dr. Michael Faluco from Jacksonville Plastic Surgery and Michelle Stapleton, an Aeroform patient. Good morning. Thank you both for joining us. And Michelle, I want to start with you because you're the only patient in Florida undergoing this Aeroform, which is brand new. Tell us what you've been through this year.
Well, I was diagnosed with breast cancer and then obviously was presented with this great, technique to help me go through the process a lot easier.
And you underwent the double mastectomy in March 1st,
right? March 1st, I had a bilateral mastectomy.
Okay, now what options did they give you and how did you come to, Aeroform right now is experimental. We're going to talk to the doctor about that in a little bit, about some of the risks, but so far, what has it been like? Explain to most women who, have never heard of this.
It was exciting to me to hear of something, because you're going, okay, I've got cancer, I'm having a mastectomy, to hear of something that could be less painful, faster, and all that stuff made everything a lot easier for me to deal with.
And doctor, we're looking at, we had a picture up of the device. How does it work? How is it different than the normal traditional reconstruction?
Well, with breast cancer reconstruction, once a patient has a mastectomy, they really have two main options. One option is using your own tissue, like a tummy tuck for breast reconstruction, or most women choose tissue expanders. And what a tissue expander is a way to expand the muscle in the skin to develop a breast mound that you eventually can put an implant in. What's exciting about this new device is the traditional devices, you use a needle and you come every week for about 4 months to expand it. This device speeds up the process to a couple weeks and is a lot less painful.
It was not painful at all.
Not painful at all?
At all, no. I was waiting. I'd heard people tell me how expansion was very painful and I was very anxious and I kept waiting and waiting and it was amazing. Now,
this isn't FDA approved. You guys are hoping to have it approved by the FDA, I imagine, pretty soon.
Correct.
What are some of the risks when you're testing these things out? There's got to be risks involved.
Oh, sure. These are all FDA clinical trials. The main risk with this is, like any other procedure, anesthesia or the risk of the procedure itself. With this trial, what we're seeing is basically, is it equivalent to what we're using, and is it safe, which it's been proven in previous Australian trials.
Doesn't that make you nervous, Michelle, using something that's, you're not quite sure about it yet? Doctors are still working out.
I really have a lot of respect for the doctors, and I trusted them, and I prayed about it, and I was like, you know what, if this is meant to be, it's going to happen, and I just kind of dove in, and it just felt right. I don't know how to explain it other than that.
Well, you are a brave woman on many levels, so I appreciate it. You look great, too. So
Thank
good luck
you.
with everything. Good luck with your treatment. Doctor, nice to meet you.
Thank you.
Hey, for more information, the Aeroform Tissue Expander, which is what we were talking about this morning, was designed and manufactured by Air Expanders, a medical device company in Palo Alto, California. For more information, you can visit the study, clinicaltrials.gov or airexpanders.com.